Glue ear happens when the connection between the back of the nose and the ear becomes blocked. Normally children and adults, when they pop their ears, they send air from the nose up to the ear, and that means there's air on either side of the eardrum, which is a good thing, because just like a musician's drum, for it to work properly, you want to have air on both sides. We can demonstrate it better by looking at a diagram. This is a diagram of the ear itself. It's almost as if a slice has been taken of my head, and here you have the floppy bit on the outside, and then down from there you go down a tunnel, the outer ear canal to the eardrum. And when you look at the eardrum side on in a diagram, it's like a line, but if you were to look actually down here, what you see is a circle. So this is a view of a normal eardrum, and it's a bit like a musician's drum, and it's circular and there's air on either side. And what that means is that when you stand next to a speaker and the vibration comes in, the actual air vibrates and it wobbles the eardrum back and forward, and the sound gets transmitted inside. And that's how the system normally works, but it all depends on that tube to the back of the nose actually working. And what can happen in children is when they get a cold, the lining of the nose can swell up, then the hole for breathing down the centre of the nose gets smaller, becomes blocked, and if that cold goes up that tube to the ear, the hole for air to get from the nose to the ear can become blocked too, and then the whole thing can get blocked here, and then the whole thing gets full of fluid, and that's called glue ear. What can then happen is you get this appearance, which is the appearance of an eardrum with fluid behind it, and the problem here is the eardrum just can't wobble in the way it used to. Also, because it's full of fluid, if any bugs get in, any bacteria get in, they can then lead to an infection in the middle ear that can then lead to the eardrum bulging as the bugs multiply, because they've got a nice warm pool of fluid that's got protein in it, and as they multiply, the eardrum can bend and then it can burst and pus can come out. The eardrum heals almost completely, but they've still got that problem. One treatment that can be done is to insert grommets. That's only done for children who don't get spontaneously better on their own, and a lot of children do, so we have to carefully assess each child. But in a child who has persistent glue ear, what can be done is a short operation for about 20 minutes where a small cut is made in the eardrum, all the glue is sucked out, and then something called a grommet is inserted. The grommet is like a little washer that actually goes into the eardrum itself, and we've got one here to show you. And so what can happen is this grommet can be inserted into the eardrum without the wire, just a plastic bit gets put into the eardrum itself, and now air can get in from the outside, and so now you get a ventilated middle ear, and so the eardrum can move again in the normal way, and you haven't got that pool of fluid that can get infected. Normally, new skin cells are made on the eardrum itself, and they migrate over about 3 months, and that movement can lead to the grommet coming out after about a year. The good thing is that there's a very good chance once the grommet comes out that the ear will then go back to normal. Thank you for listening and for watching this video. No matter what the ear, nose or throat problem a child has when they come to clinic, they need a full detailed history to be taken, they need a proper examination, and then where appropriate they need investigations to be carried out. And it's at that stage a balanced decision can be made as to whether the way forward is observation or medication or possibly surgery if that's felt to be best for that individual child. Thank you very much.